EU za tebe is not just a slogan. This is what we really mean. It means that we are there as European Union for Serbia. For the past 20 years, we already have been extremely active as European Union in the healthcare sector in Serbia. We have outfitted hospitals, we have renewed kitchens in hospitals, operating rooms, and we have also, for example, provided ambulances. Also for smaller communities, the European Union contributed to the medical centers renewal, and those are even more important because they reach the smaller communities' most vulnerable groups: children, women and disabled people. But the world has changed, and so as European Union we have also been very active when it was the COVID period. Nowadays, health issues are not purely national anymore. COVID-19 has showed us that health issues are transboundary. They do not know where the border of one country ends and the other border begins. So therefore, we have also engaged ourselves as European Union in helping Serbia during the COVID times. EU za tebe is this project. It's at the heart of this project. We are here for Serbian children. So actually it should be EU za decu. So this is a state-of-the-art hospital that needs to be built in order to be able to take care of the medical needs of small children. Children are the future of our society everywhere in the world, which means that we should be able to provide them with the best care possible. Now, this state-of-the-art hospital, University Hospital Tiršova 2, will have not less than 301 rooms. There will be 6 emergency and intensive care units. So this is really a state-of-the-art facility to which the European Union is contributing 35 million euros. But there is even more, because we also need good doctors and we also need good pediatricians. Pediatrics require a very, very special approach. A child cannot be treated in the medical field like you treat an adult. That means that also the doctors should have our moral support, and that means that they also have to be able to work with medical devices that are enabled to treat children. A child, the most important thing as a doctor, as a pediatrician, when you treat a child, is that you can win the confidence of the children. And so that means that you need a certain build-up. That means that also the surroundings, the infrastructure has to be welcoming, warm, and that is all being guaranteed by Tиршова 2. You can also not use the same medical devices to treat children, because you're treating not an adult body, you're treating a small body between 0 and 16 years old. So also there, our commitment of the European Union to helping the healthcare sector in Serbia will be most valuable. EU za tebe means that we are there for Serbia, which means that we are also there for the healthcare sector. Healthcare is not only about providing funding for facilities, for the infrastructure. That is only part of it. As European Union, we also have to look at other elements for the healthcare of Serbian citizens. Everything starts with education. Education means that we have to be able to train enough doctors, enough nurses, enough stomatologists, enough healthcare workers who can support the whole system. It's like a whole dynamic that needs to be created, that healthcare comes at the top place. Healthcare is a top priority not only for Serbia, not only for the European Union countries, but basically for the world as a whole. It is a basic right. Beside the education part, there also needs to be a research part. You cannot have good healthcare if you do not invest in research, university research. Tiršova too is a very good example. The hospital will also be a university clinic, meaning that there can be research done at this hospital. So the third part is the accessibility. And this is a vital component of good healthcare. Accessibility means that you also have to have the medical centers, the hospitals, the laboratories. You have to have the whole surrounding infrastructure to support excellent healthcare. And this is exactly where the European Union is playing a very vital role here. Well, Serbia is a fantastic country. It is a candidate to EU membership, and the best way to reciprocate is that they join us in the European Union when they have worked on all the conditions for their accession. And we all, as EU27 and the EU as an institution, look forward to that. With regard to Belgium and Serbia, I'm very proud of the healthcare system in Belgium. We have access, we have enough doctors, there is no problem with access to surgery. Even from abroad, people are coming to Belgium to have surgery, and we even have an excess capacity in hospital beds. Believe it or not, this is rare these days. But there's one element in which Serbia and Belgium can still also communicate a lot more, and that's an important aspect of healthcare, and that is prevention. Healthcare, and when you talk about hospitals and medical centers, it means that you're already in a situation that your health is not good. Much can be done in preventing that the disease, surfaces. For example, healthy eating, less meat, less fats, lower cholesterol levels, no smoking, less cigarettes. Those are all part of preventive policies which Belgium already developed and in which we can assist Serbia in sharing knowledge and information.
Izgradnja nove bolnice ima ogroman značaj. Radi se o jednoj savremenoj, modernoj bolnici i pored toga to je ne samo nova, moderno opremljena bolnica, to je jedan potpuno novi koncept lečenja dece u Srbiji. Jedan savremeni koncept lečenja zasnovan na svim europskim modernim principima lečenja dece. Možda ja nisam prava osoba, ali mogu reći da je to jedna od najznačajnijih donacija. Donacija je bespovratna, oni davaju za izgradnju bolnice 35 miliona evra, što čini trećinu od ukupne sume koja je neophodna za izgradnju ove bolnice. Na bolje u svakom slučaju. Radi se o izgradnji jedne velike bolnice, opet da se ne ponavlja moderne bolnice. Većina zdravstvenih radnika koja rade u dečijoj ustanovi uživaju u svom poslu i sa zadovoljstvom rade, tako da će im biti ovdje omogućeni svi najbolji uslovi da obavljaju svoj posao, koji će raditi najbolje što mogu. Opet, da se ne ponavljam, znači radi se o savremenoj bolnici, opremljenoj bolnici gdje je sve izračunato, gdje su optimalni uslovi za smještaj bolesnika, optimalni uslovi za smještaj roditelja pacijenata, savremena dijagnostička oprema, najsavremenija dijagnostička oprema. Većina naših lekara je imala edukaciju u evropskim zemljama i apsolutno mogu da vrlo brzo primjene tu novu tehnologiju i da rade sa najnovijim aparatima. Sigurno će biti boljitak u dijagnostikovanju i lečenju bolesne dece, u smještaju pacijenata. Biće komfornije i za decu i za njihove roditelje, a i za same lekare i ostale zdravstvene radnike koji se bave ovom dečjom medicinom. Pa smatram da u mnogim segmentima jeste. u mnogim segmentima jeste. Ja mogu da govorim o našoj, o dečjoj klinici, tu imam dobre informacije. Većina naših lekara ide na edukaciju u inostranstvo. Sve generacije lekara, i ovi koji su, da kažem, u kojoj spadam ja, starija generacija i srednja generacija i mlađi lekari su maksimalno požrtvovani u svom poslu, puni su empatije prema pacijentima i pružaju maksimum svog znanja i svojih veština. Drugi dio pitanja, na što sam ponosan? Ponosan sam na entuzijazam lekara koji rade ovdje. Ponosan sam na to što su moji kolege lideri u oblastima kojima se bave u regionu, što veliki broj lekara naših odlazi na edukaciju, što veliki broj stranih lekara sad dolazi u Tiršovu. Mi smo uspostavili saradnju sa velikim evropskim centrima i njihovi lekari dolaze i vrše operativne zahvate ovdje. Tako da ta saradnja vrlo brzo će biti dobro realizovana, tako da od toga najveći boljitak imaju pre svega pacijenti naši, a potom i svi zdravstveni radnici koji učestvuju u lečenju dece.
Evropska unija i Serbija zajedno grade bolji život za sve građane. Stalo nam je do Evrope, stalo nam je do Serbije i njenih građana, bolji smo zajedno.